All right, so we're going to demonstrate a Sculptra injection in the face. Sculptra is basically stimulates your body to create collagen. So our patient has lost volume in her face, so we're going to basically inject some down in here, up here, and then down in her chin region here. And that's going to give her more volume here to decrease the nasolabial fold. So we're going to start up here, and what that's going to do is going to pull back this way a little bit. So a little pinch. 1, 2, 3, pinch. I hear something. We're going to come down here. There's a nerve right here. This actually has some numbing medication in it also, so this part of her face is going to go numb. That's normal. It'll come back in about 2 hours. Pinch. And this is injected all the way down into the bone. Almost done. Good.
Good job. Doesn't hurt. No.
Good.
No, not really.
So you can see she's going to get more volume. She's going to probably need another 1 or 2 rounds of Sculptra. We want to get some volume up here also, and that's going to pull up here and decrease this fold. Let's do the small needle. Let's just do this side over here. All right, so now we're going to come down here. There's a nerve about here also, so this part of her face is going to go numb. And again, that's going to come back in about 2 hours or so. Alrighty, you can see kind of that's filled out that already. This takes about 4 to 6 weeks to start stimulating your body to create the collagen. We're going to do this side, pinch. One downside with Sculptra sometimes is it clogs the needle. This I usually mix up about 5 to 7 days before a patient comes into the office. Used to mix it up the day of injection, but it was very hard to inject, so now I mix it up 5 to 7 days beforehand. You okay?
Yeah. Yep. Doesn't hurt.
Face going numb?
Yeah. It feels kind of funny, but everything else doesn't hurt.
Good. Alright, so we're going to do this side now. We're going to start up here actually. Pinch, 1, 2, 3, pinch. So sometimes you hear a little swooshing when you inject up here because you're right by the ear canal. And it looks like it's really deep, but it's going down to her skull, but there's a space right there. So we're trying to fill that to give her this pull back, almost like a liquid facelift pulling up in this direction. Injection. The studies that the company did were based on 3 injections spaced about 4 to 6 weeks apart, and they had long-term results of up to 2 years. So depending on the person, kind of depends on how many injections. We have patients in their 30s that do 1 injection, come back about 18, 20 months later and do another injection just to really kind of maintain their volume. And then other patients that have had a lot of volume loss where they need like 6 injections. It all depends on the patient. So she'll have more volume for the next couple of days, then the body will kind of resorb the water and lidocaine that was in that, and then it'll go back down to where she was beforehand, and then the body will start increasing her collagen production. So that's how we do a Sculptra injection here at New Beginnings.